Hi, my name's Kayla. I have a 3-year-old son named Logan. When Logan was about 6 months old, his grandmother and his father took him to a foot doctor to get the first of a series of 4 sets of casts on his legs to straighten out his feet because he was pigeon-toed. And at this time, his grandma noticed that there was like a lump in his back, and the doctor took some x-rays. And the foot doctor told her that this was very serious and that Logan could be paralyzed from the waist down and he may never walk. So we scheduled an appointment with Dr. Price at Children's Mercy Hospital. Dr. Price reviewed the x-rays and he said that this was fine. It was a gibbous disc, which meant that one of the discs in Logan's back formed like a triangle instead of forming like a rectangle. And it was a bit of a problem, but at the degree it was at, we were going to use a back brace, which we did for a while, and it didn't really help. So now we just take x-rays every 6 months or so to measure the degree of the bend in his back, and it's currently getting better by a few degrees. So as long as it keeps that trend, then we won't have to do surgery. But if it gets any worse, then we will consider doing a surgery on his back to help correct the problem. So then he looked down at the family history chart and he seen Hunter syndrome. And he looked right up at me and he said, "Who has Hunter syndrome?" And I told him my uncle does, and on my mom's side, and he said that gibbous disc was really common with people who have Hunter syndrome, and so he needed to do some testing to see for sure if Logan had it or not. So we did the testing, and it came back a few months later that Logan does have Hunter syndrome. And then he introduced me to Dr. Smith in the genetics department, and Dr. Smith told me about Elaprase. Elaprase is a one-of-a-kind study that is the only treatment available for Hunter syndrome, and it's done by infusion once a week for indefinitely. And the downsides, it has a black box warning, and it's never been tested on children under 5. And if he misses 2 infusions in a row, then he has to get a steroid in order to get it again. And if he misses 3 in a row, he can never get Elaprase ever again. Every time he misses due to a fever caused by either ear infection or a flu, it increases the risk of him having a terrible side effect that may lead to death. However, if he doesn't miss very many and he gets Elaprase once a week, that it would increase his quality of life tremendously. So how could I say no, right? So at that point, she presented me with my next option. We could either have a port placed, which a port would enable them to be able to put numbing cream on the site and poke him one time, and he pretty much wouldn't feel it, and then fast and easy. The other option was to have to try and find a vein in his arm every time, and they tend to have thicker skin, and so it's harder to find the veins. So they might have to poke him several times opposed to just the one time. But the downsides to a port are he can't play any contact sports, because if any trauma comes to the port, he could bleed to death in 15 minutes. It's pretty scary. Also, it could get infected and he could become sick, but the chances are really slim because they're very sterile and very good at their jobs. So I decided, well, first they let me watch another little boy. They introduced me to this family. He also has Hunter syndrome, and he's about Logan's age. He lives up at, well, he was living in a town nearby, and I watched him get accessed in his port, and I decided at that time that I wanted Logan to have a port too, and we did the surgery and had port placement, but before we could do that, we had to do a heart echo to make sure that his heart was healthy enough for the surgery. After all of this, Logan has since had his tonsils and adenoids removed. He's had a sleep study that has showed restless leg syndrome, sleep apnea, which makes it difficult for him to sleep at night. They've put him on a high dose of iron and recommended melatonin to help him fall asleep. And he had tubes put in his ears because he failed several hearing tests. And the tubes helped tremendously. But the right one's recently fallen out and the ear infections have started again. So we have to go back to the ENT on the 15th to see if maybe we need to have another tube placed in there, or if there's anything else they can do to help with the ear infections. On the 18th, we're having the test to see if he's got carpal tunnel or not. And I'm going to be updating this channel every week after his infusions and after every appointment. This is Logan living with MPS II.